Welcome to the Preventive Medicine Podcast. Help us change the paradigm of medicine from keep people alive to help people thrive, one episode at a time. And now, here's the show. Yeah, I think we'll touch on a little bit about more like physical therapy itself later on in this. But for some reason, whenever you think of physical therapy, you think that the people who are going through school understand something about strength training and how it like applies to health and like physical therapy itself. But for some reason, that isn't the case. I'm not exactly sure why. So what you're doing is absolutely amazing. I'm scrolling through your posts and they're very informative. So I just want to give you props for that.
Thank you.
So leading on to that, we ask everyone the same question kind of on here. One of the things that we try to do on this podcast is get different perspectives from different people. And the main question is, what does preventive medicine mean to you? Because to everyone, it means slightly different things. And then there's some consensus and sometimes there's something slightly different. So what does that mean to you?
Yeah, so I definitely agree that there's going to be a huge spectrum because I don't think that there is one necessary agreed upon definition for that. And in my mind, I view it as essentially the different characteristics and various activities that we can do on a regular basis that will reduce our likelihood of chronic illness and exacerbated disability. So that's a pretty vague definition, but I think inherently with preventative medicine, you're going to be looking at an incredibly wide spectrum of things.
Definitely. And I think one of the beauties of preventive medicine is that it is so broad. There's just so many different aspects of it. And that's why we like to have different perspectives, like yourself being from a physical therapy and strength training perspective.
Yeah. And it's, I think one of the things that hopefully we'll accomplish with this podcast is kind of piecing together different professional aspects of what certain people see in their practice that makes them think of their answer of what is preventive medicine, and put together this kind of puzzle of, a more complete picture of how do we look at preventive medicine as, a group of future professionals. And, even for the lay people listening, what should preventive medicine mean to us, just as people? In that vein, something that is super, super important right now, especially in the United States, is low back pain. So we know it's one of the most common causes for a patient visit to a doctor in the United States. We know a large amount of the healthcare burden is involved with low back pain, and physical therapy as well deals with a lot of low back pain. And there tends to be a lot of theories out there of why we have it, how we treat it, and what to do about it. But sometimes those ideas don't necessarily align with the evidence. So I know this is a deep rabbit hole to jump into right off the bat, but what are your thoughts on kind of what the evidence says about low back pain, and what can we be doing better as clinicians to address this problem?
Yeah, that's an excellent point. There is a huge rabbit hole on this topic. I think right out of the gates, anything that I say, there will obviously be possibly holes in it. There will probably be some contrary evidence, as there is a vast field of literature on this topic. But as a general, I don't think we can ever say that we necessarily know what is causing someone's low back pain. For the vast majority of humans, they're going to be experiencing what is called non-specific low back pain. And it's hard to put an exact number on it, but probably around 97% of cases are that, which is the majority. And outside of that, then we're looking at, highly specific things that are likely going to be managed through primarily hospital-based care, such as like Corda equina syndrome, tumors, different stuff that's going to be necessitating a more significant degree of care. And for pretty much everyone else, we don't have a deeper specific diagnosis that we can necessarily give. You'll find lots of people that will provide them, but that doesn't necessarily mean that the evidence actually supports that diagnosis. For instance, a lot of people will be given a diagnosis of disc herniation, spinal stenosis, spondylolisthesis, all these different ones that you can find that are various anatomical deviations from what we perceive as normal. However, as you start to look into the base rates of these things and how often they occur in someone that doesn't have pain, as well as when you can find someone that has multiples of them and is experiencing pain at different sites, there's just a lot of things that start to outline that they're not necessarily so strongly linked with someone's pain experience. That's where we start to enter a lot more challenges in, it's easy to notice these things, and it's a little bit easier to point and try to address them. Whereas when we start to look at the literature that guides us in possibly other contributing factors to back pain, like socioeconomic status, access to healthcare, all these different things that probably contribute a lot more, as well as what the person's meaning is to their back pain, it starts to get a lot more complicated where, it's, if someone has a disc herniation, I can tell them that's your problem, and all we have to do is just snip it and you're good to go. In contrast, if someone is having low back pain because they have significant financial stresses that are associated with where they live, the people that they have around them, all these different things like that, that's not so easy to change. And that is a much more complicated thing to also explain to the person and to get them to be able to reconcile when their stressors come on and the pain that they have and what they can then do for it. And I think that's one of the big challenges that we have right now in the medical system is figuring out how we can transition to more care like that.
100% agreed. And I think you brought up so many different factors that go into back pain. And as you described, the medical system kind of has a really reductionist approach of how they approach a lot of medical conditions, back pain included. And that also leads into the diagnostic rabbit hole, so to say. We had Dr. Austin Baraki on from Barbell Medicine, and he talked about a lot of overdiagnosis in cases where, like you're mentioning, on your Instagram post today, where you talked about disc herniations and back pain, where a lot of times they'll just recommend surgery straight up, and that disc herniation might not even be contributing to their pain. So that's why I think that we don't have a lot of clarity on where we're going with back pain, a lot of different diagnoses, which is why prevention and other means of maybe getting rid of this back pain, not necessarily rid of it, but reducing our risk for back pain is probably the better route to go until we have more diagnostic evidence of exactly what we should be doing for back pain. So in that vein, is there anything you would recommend to people who might not have back pain now, but want to prevent it?
I think one of the things that we can consistently see across a lot of research is that generally, people who are of better overall health, while that is a vague term, do generally experience back pain to a less severity and less frequency. So, taking care of a lot of things like your daily step count, your general sleep from both a quality standpoint and a quantity standpoint, reducing your comorbidities from other health standpoints. Like if you have diabetes, you will have a greater likelihood of experiencing chronic low back pain. And so if you can have diabetes managed more appropriately, that may benefit you from reducing your likelihood of risk of back pain. And that's going to come with a lot of other factors, probably like increasing your overall physical activity, managing your nutrition to a better degree. We also see that individuals who are generally overweight also have a higher risk of more low back pain. And so people don't necessarily love that answer, but in a lot of cases, it's do a lot of the basic low-hanging things consistently on a regular basis, and you'll probably do the best thing you could ever do from reducing your overall risk across back pain, across risk of death in almost every category. And it's not a very sexy answer, and a lot of people don't love it, but sleep roughly 8 hours a night, go walk at least 4,500 steps a day, have friends that don't drag you down, do things that you enjoy on a regular basis, don't binge drink, and manage your weight.
Preventive medicine is an incredibly important topic. I want to thank you for taking the time to watch this video. For the full episode, find us on your favorite podcast streaming platform. If you enjoyed this video, don't hesitate to hit that subscribe button, like this video, and share it to keep that message spreading. Thank you once again for watching this video, and we'll see you in the next one.